In this video, you'll learn about modern medical imaging techniques. Imaging techniques allow us to see into the body. This can be useful for a wide range of applications, including diagnosis, research, helping to direct treatment, and monitoring development. X-rays are one of the oldest and most familiar medical imaging techniques. X-rays rely on a form of high energy electromagnetic radiation with a short wavelength that passes easily through soft tissues of the body, but is absorbed by denser structures. Two-dimensional images of the bone and teeth are commonly made by directing this X-ray radiation through the body and onto a special film or digital sensor. Chest X-rays are commonly used to evaluate the health of the lungs. Here you can see a comparison of a normal chest X-ray to a chest X-ray from a patient with tuberculosis. Mammogram is a form of X-ray imaging that's used to screen for breast cancer. Fluoroscopy involves administering a chemical to provide better contrast for X-ray imaging. Barium is a contrast agent commonly used to image the gastrointestinal tract. An angiogram is an X-ray that uses an injected contrast to image blood vessels. Computed tomography is an imaging technique involving an X-ray source and detector that rotates around the body. Computers are used to combine the resulting data into several cross-sectional images or slices that can show details about soft tissue structures in the body. Computed tomography, or CT, is sometimes also known as a CAT scan. Here we see multiple transverse slices from a CT of the head. Computer models can also use data from CT scans to create a three-dimensional representation of the body. Positron emission tomography, or PET scanning, is an imaging technique that involves the administration of a radiopharmaceutical substance that emits a radiation. A special digital sensor detects the radiation emitted by the radiopharmaceutical as this chemical travels throughout the body. Computers then process the data to produce sequential images that can illustrate physiologic activities such as blood flow or nutrient metabolism. CT scan and PET scans can be recorded simultaneously, and the data combined together to get more details about the structure and function of the body. This technique is often used for research, but can also be important for the diagnosis of diseases, especially cancers. There is some health risk associated with ionizing radiation, such as X-rays or the gamma rays emitted by certain radiopharmaceuticals that are used in PET scans. This is because the ionizing radiation can damage DNA. This can increase the chance of developing cancer. And when the reproductive organs are exposed to ionizing radiation, damage to the DNA can cause developmental disorders next generation. We are always exposed to ionizing radiation from the sun and other natural sources of radiation. When we take a flight on an airplane, this increases our exposure and has a similar risk as what we would be exposed to with many medical imaging scans. For example, A typical dental or skeletal X-ray involves less exposure than experienced in an airplane flight across the country, which is around 2/100ths of a millisievert. A mammogram exposure is around 4/10ths of a millisievert, which is approximately the same as 100 hours of airplane travel. A typical CT or PET scan is substantially greater, with around 5 to 20 millisieverts of ionized radiation exposure. But these scans are comparable to the radiation exposure that would result from spending 1 year at high elevation, such as in the city of Denver, Colorado. Medical professionals must consider the potential risks and benefits of imaging procedures. However, with appropriate precautions, the risk is often relatively small compared to the diagnostic value of these imaging techniques. MRI stands for magnetic resonance imaging, a technique that uses powerful electromagnets to stimulate the emission of radio signals from tissues in the body. The radio signals are detected by sensors, and computers process this data to produce images of internal body structures. Here we see an example of an MRI showing herniated intervertebral discs. One benefit of MRI is that it does not damage DNA the way ionizing radiation does. However, MRI may be uncomfortable, as patients are often required to remain stationary in noisy scanners for a long time. Another risk is that the powerful electromagnets can attract iron-containing metals. For this reason, patients with certain prosthetic devices cannot undergo MRI scan. Here we see an MRI scan of the knee showing damage to the anterior cruciate ligament. Diffusion tensor imaging uses an MRI scan of the brain to create pictures of the white matter tracts of myelin within the central nervous system, showing how different regions of the brain are connected. Functional magnetic resonance imaging can detect changing levels of blood flow through the body and is a common technique for studying the locations of different brain functions and changes associated with disease. MRI can also be combined with positron emission tomography in order to get more detail about the physiology of the brain. Ultrasound, also known as a sonogram, is an imaging technique that uses the transmission of high-frequency sound waves to generate an echo signal, which is converted by a computer into an image of body structures. Although the images may not be as detailed, this technique does not involve ionizing radiation exposure. So this is commonly used to monitor fetal development during pregnancy. Ultrasound can also be used to assess the health of visceral organs such as the heart, kidneys, urinary bladder, and gallbladder. An ultrasound of the heart is also known as an echocardiogram. Here we see a baby that's having an echocardiogram. A vascular ultrasound is used to image blood vessels, and this is commonly used for the diagnosis of blockages, aneurysm, or other vascular abnormalities.